Dr. Amy Thompson's here with Cone Health, discussing respiratory virus season and what you need to do to stay healthy over the holidays. We had someone write in saying, should anyone get two flu shots this year?
I haven't heard of a two flu shot recommendation. The person might be referring to a recommendation about a higher dose flu shot that is for people that are 65 and over. So your immune system can kind of start to decline a little bit as you get older. And so we do have a specific flu shot that is a high dose version for people that are older. But I haven't heard anything about two flu shots.
If anyone else has immune issues, can they get the higher dose shot too, or is it just for 65 and older?
So I would say that this probably would be a question you would need to ask your doctor specifically for you. It's hard for me to say specifically what type of a issue that you may have going on that might, make your doctor want to give you the higher dose or not, but that would be a conversation to have with them.
How effective is the flu shot this year?
So, we have different flu shots that come out each year. So they go and do some research about what kind of is going on out in the community. Flu shots this year and previous years are very effective. It's definitely a recommendation that I think that most people, or if not all people, should consider because they are so effective and it's relatively low risk for the benefit that you're going to get.
If you still can't shake your COVID or flu symptoms, but you're testing negative, are you contagious?
So you may, depending on what kind of COVID test that you get, you may test positive for quite some time afterwards, maybe even as long as up to 90 days afterwards. If you are feeling better, your symptoms are resolving, or maybe you had no symptoms, you are probably okay to kind of go back out and remove yourself from isolation. It would be a good idea to wear a mask, but if you were at all concerned about maybe passing COVID along to someone, say someone that's in your life has a high risk of getting really sick from COVID, might be immunocompromised or have some kind of an underlying health condition, trying to distance yourself from them or wearing a mask is the best way that you will have to be able to accomplish that.
Is Paxlovid still a good treatment option? They were worried about rebound cases if they take it.
So we have a lot of data that is coming out about some of these treatment options. Besides just Paxlovid, we kind of have some other things that are available now. I think, again, this would be something that would be good for you to talk with your doctor about. Even if you don't necessarily have a doctor, but you're sick and you're kind of interested about, is treatment option for COVID right for you? You can schedule a telehealth visit or kind of a virtual visit online, and someone will be able to kind of give you more information that's specifically tailored to you and your situation. So that would be my recommendation.
Yeah, when do you do a scheduled visit like that versus going to the ER?
Oh, going to the ER is probably not what you want to do. So if you are really, really sick, or you feel like you are having symptoms where you just cannot breathe, or you're having chest pain, pressure, stuff that doesn't go away, definitely go to the ER. But if you are just kind of mildly symptomatic, or you just want to know, could I do a treatment, you're going to have to wait probably a long time in the ED or in the emergency department. Whereas if you did a telehealth visit, you could be in the security or the luxury of your own home and not really have to go out. Plus, you don't really expose other people to COVID if you have it and you kind of do those telehealth visits. So that's really convenient if it's something that is available to you.
Okay, we've got about 30 seconds. Your last pitch on why someone should get the vaccine if they have it.
If you haven't gotten the vaccine, you really should get it. It's not too late to get it now. Not only is it for adults, also children that are 5 or over can get a bivalent booster. Even kids as young as 6 months old can still get their primary vaccine series. We've had a lot of data that's come out. Hundreds of millions of people have gotten a COVID vaccine. It's not anything to be scared about anymore.
Well, thank you so much. We appreciate all the knowledge you've imparted today.